We're keeping the education going, talking about commonly prescribed drugs, and for today's video, we're going to break down how Omeprazole, sold under the brand name Prilosec, works. This is used for gastroesophageal reflux, also known as GERD or just acid reflux, but some people refer to this as heartburn. And this drug is a proton pump inhibitor that works on the stomach. And in the stomach, there's a variety of these proton pumps that bring in hydrogen. And the increase in hydrogen actually increases the acidity of the stomach. And that creates acid reflux, as well as an ideal environment where bacteria that can cause ulcers could thrive. But when one is prescribed Prilosec, it creates a lining along the stomach wall that prevents more hydrogen from coming in through those proton pumps, therefore decreasing the amount of stomach acid produced and decreasing the likelihood that the environment where bacteria that could lead to ulcers could thrive. You can almost think of this like a shield that's blocking that acidity from coming in, but it's also giving time in the background for any damage that has already been done to the stomach to heal before one stops taking Prilosec. And that's because over the counter, this is typically given for just about 14 days, but if somebody has a very extreme case of GERD or acid reflux, they may be prescribed it for longer from their primary care provider. So to learn more about different therapeutics and how they work, make sure to stay connected to my channel and with Dane Garvin.